If we just close the door around Denmark and start sorting our garbage and using less and making huge progress, then it won't make a difference according to the 1.5 degrees or not.
Yes.
Because we are too small. Yeah. So even if all of Denmark stopped emitting anything, the water would still be rising on the globe because we are such a small player on the field. But that does not mean that we can't set the direction of the game.
No. Hello and welcome to the Sustainable Healthcare Podcast, the podcast where we talk about everything sustainability related at healthcare, pharma, medtech and hospitals. Today I'm back with another talk with Maria Gaden, head of Center for Sustainable Hospitals at the Central Region in Denmark. And in this episode, we talk a lot about the Scope 3 emissions from hospitals, how that relates to suppliers from the medtech, pharma and other industries, how the regulation is coming. And we also have quite an interesting talk about the global perspectives around sustainability in healthcare and why Western healthcare systems have a responsibility to get this right. Because as a global society, if all healthcare is going to be done the way we do it in, say, for instance, Denmark, it's definitely not going to work. So please enjoy the episode. It was absolutely wonderful to have Maria in. Welcome back to the Sustainable Healthcare Podcast, Maria.
Thank you. It's good to be here.
It's so good to have you here. And would you introduce yourself?
Yes, I would. I will. My name is Maria Gaden, and I am leader of Center for Sustainable Hospitals in the Central Denmark region. And we are a unit that covers all the 5 hospital units, plus the psychiatric hospital and the social departments and staff buildings in the Central Denmark region, which is the second largest region in Denmark. There are 5 regions in the very small country of Denmark, and Central Denmark region is the second largest one. We have 30,000 employees. Yeah. So that was like the facts and the numbers. So what are we doing in the Center for Sustainable Hospitals? We are trying to support all the units, basically, in the transformation towards circular economy. Focusing on circular economy, but of course with a broad definition of sustainability as our key value, you could say. It's not just a crusade on lowering the CO2 and not caring about anything else, definitely not. We're looking for sustainable solutions.
Yeah, amazing. Yeah, and it's funny that you're mentioning that, yes, we are a very small country in Denmark, 6 million people, but because the healthcare is relatively central organized, it's actually on a global level, the central region of Denmark is a relatively large healthcare system. And we had you in on another episode where we discussed all your good work at the hospital and the internal work and how to get started, build alliances, have the dialogues, and
with the employees and stuff like that.
Yeah, which I highly recommend listening to as well. And in this episode, we are going to discuss a lot about Scope 3, the consumption from the hospitals that are coming from outside the hospital themselves in the supply chain, the consumption, and also how suppliers and partners can work with you and how you're already trying to do that. But why is Scope 3 so important for hospitals and healthcare systems?
Because it's our biggest problem, basically. The data we have on our CO2 emission are estimates, and it's in some ways rather poor, though it's getting better. But the picture is quite clear. In the Central Denmark region, our recent environmental footprint calculations says that 84% of our total CO2 emission from all the hospital units comes from Scope 3, from goods and services that we buy from outside our own garden, you could say. only 4% comes from our electricity, heat, and water. And that could be quite surprising because those are huge buildings and they are open 24/7, 365. And we have scanners, we have all sorts of electric equipment. But we have been quite good in Denmark and in the Northern Europe, I think, of optimizing on scope 1 and 2. And that's good. We should be proud and we should keep on doing that, of course. But what we have not been aware of is how much our scope 3 is actually emitting. And of course, it is not emitted in our garden on our national ground, but it is emitted somewhere else because of the way we are consuming, and it is affecting health globally. So we do have a responsibility.
So what are some like low-key practical examples of a consumption that goes on at a hospital that contributes to the scope 3 emissions?
We talked about the metal instruments last time, and that could be an example. And it's not just metal instruments; it's also instruments that consist of both metal and plastic and electronic components and stuff like that. But they are, of course, the raw materials are drawn out from the ground. Could be in Central Africa or something like that, transported around the globe, being produced into raw materials and products somewhere else. I think some of those suturing sets I mentioned in the other podcast, we actually learned from that case that it is produced, most of them in Pakistan, under not very sustainable conditions, you could say. Unfortunately, really hurtful to know. And then it is flown to Portugal, where it is sterilized, and then up in the air again to Denmark, where it is being used for a very few seconds, and then it's thrown out, and then we put it on fire. So that's really just all the way through the chain. You're thinking, wow, so much we need to improve here to make a sustainable consumption of those very important tools. We need them in healthcare to produce health, but we should definitely look through the whole value chain.
Yeah, that's always the challenge, that there's just the like key parameters on patient health and effectiveness and efficiency, safety, that we can't really compromise on that. But nonetheless, there's so much that can be done.
So much that can be done, and I think if we as healthcare system needs to take a full responsibility, we need to open up our perspective. Because what is happening right now, I think, in some around some tables anyway, is saying that, but we just need to sort our garbage and make sure that the packaging is recyclable. I'm not saying that those things are not important. They definitely are. But if you picture that journey I just mentioned, from Africa to there, to there, to there, to doing this and that, and the conditions that people are working under all through the way, and that we just put it on fire. So it doesn't really solve the problem that we take our packaging from the scissor and put it into a recycling bin, where some of the packaging might be recycled and used for whatever, something. but it doesn't really solve the problem. It does not create a sustainable healthcare value chain.
No, and I think often sometimes overlooked issue as well, that when we are curing or creating better health for one patient in the Western world, say, we are creating poorer health for other people. There's depending on the calculations, 8-10 million people dying of air pollution each year. A lot of medicine, for instance, antibiotics, are being produced in ways where a lot of it ends in rivers and other people. So even from a purely health perspective, if we include the health of all people on the planet, that should be a major motivator for change.
Exactly. And also, when we're talking on the global scale, you can say we are facing challenges on a demographic in the demographic area right now, and also these low and middle income countries, where you can see gladfully the level of income is rising.
Yeah.
The welfare should be rising as well. So probably in a few years, I don't know how many. That's not my field of expertise, but they will probably be building up a health system. They're probably doing it already by now, and we are really facing some challenges according to raw materials and resources if they start consuming the way that we've been doing for the last 10 or 15 years. We can't afford that.
No.
So it's really important that they definitely don't start repeating our mistakes on single-use and non-circular consumption in the healthcare system. So I think there's a big responsibility for us who have faced, because we do know that this is not sustainable. We know it's not going to work in 10, 15 years. We already know that. So I think we have a responsibility, and it's a necessity that we find circular solution for consumption in healthcare now, and then we need to scale it out. There's a huge market here. There should be, anyway. So someone could make a huge business of exporting sustainable healthcare solutions globally, because healthcare systems will be building up, I think, in these parts of the world during the next years.
They need to be in the hope, and
they should be.
Hopefully also just a business just by selling to you guys and your new ways of procuring and setting demands. I'm also assuming that the private companies who are producing medicine, producing medical devices, are producing paper, sterilization stuff, all these kind of things. Can you get what you need from them, or do they need to do something differently as well in the future and create different products for you to be able to have a circular hospital?
I think we all need to do something differently. Yeah. It's not like there's not a shelf on the healthcare market with everything we need. It's just too expensive.
Yeah.
Some things are there, but other things are not. So I think it's a common task. We're on a common mission. I think we should see it that way.
Yeah.
The private and the public sector together, trying to solve this challenge, because it is best solved together through the whole value chain, with the recyclers as well. They should be there as well, and the producers of raw materials, they should also be taken into consideration. Again, back to the larger perspective. If we want to change this, then we need to change the whole value chain. So we definitely need more cooperations with the producers. We are
quick plug. We have an episode coming up on material extraction from mines and cement and copper and whatnot.
I will look forward.
Brilliant expert. Well, excellent.
Yeah, because that's really a bit of a black box.
I think
knowing what's really going on there.
So that's why we're doing.
Yeah. So I think we need to address the challenges together from both perspectives, because I mean, it doesn't really matter if we demand things that there is no business in. No one's going to deliver it to us. There's no need for them to start selling us something that is 3 times as expensive, and it doesn't work that way. We need to find the solutions together for them to be truly sustainable. And I think it's possible, but we need to be, of course, innovative, and we need to be a bit careful as well, maybe.
So have you started having these dialogues with private actors and maybe with the procurement departments also?
Procurement departments is doing a great job working on this one step at a time, one tender at a time, trying to figure out what are the options within this area, what's on the market now, where can we push it, how can this work? We have some very interesting and potential conversations, I think, with different actors. I can't put any names on now. And we're also trying to reach out to, of course, all the knowledge institutions, because we need research. We need young engineers, or old, I don't know, whatever, curious engineers and healthcare professionals and all sorts of, it's really... we need this interdisciplinary research and transdisciplinary research within these areas to figure out what the good solutions are.
So if you fast forward 5 years and imagine there, how do you see the procurement situation being around sustainability? Do you think it will be integrated into all tenders, or
Yes,
with quantifiable goals, not quantifiable?
hopefully both.
Yeah.
And then I think we are looking into new business models. If we need to switch from single use, as we talked in the other episode, there's a general tendency, and all the research, almost all the research shows that multiple use is by far the most sustainable way of consuming in many, many cases. And if we need to switch from single use to multiple use, maybe we need to look into other business models. Maybe we need to look into more service-minded business model between the producers and the consumers. Maybe we need to, what you say, right now we are cleaning a lot of stuff ourselves. Maybe that's a good idea. Maybe we need to upgrade on that. Maybe we need to let someone else do it. Maybe it can be a socio-economic area as well for people on, what's it called in English? On the edge of the flex workers, stuff like that. Maybe we could actually, maybe we could create jobs in this transition as well if we coordinate it with the municipalities and try to make some really sustainable solutions around our consumption.
Yeah, there's one I think it's Grundfos Oil to Danfoss. They have a wonderful, really amazing take back programs where you can send your pumps back.
Yeah.
And then they are restored by these wonderful people who have some kind of disability, physical and mental, but have a very meaningful job there.
Yeah.
And I think the take back solution is even free for companies. So go do that out there.
Go do
you
that.
Have some
but
pumps,
something as simple as scissors.
Yeah.
We use a lot of scissors in the healthcare system. In the old days, they were of course sharpened and repaired, and not just scissors, all sorts of instruments. At some point of time, that was too expensive because the payment per hour for a worker standing and repairing them was so much more expensive than just buying a new one, even though picturing the whole value chain, all that needs to happen to actually produce a new scissor. It was still cheaper to buy a new one than to repair the old one. And that was, of course, also the beginning, or I could say at the same time, the single-use switch really rolled in.
So one of the things that we're hearing from the industry and working with our clients is like, hey, we spent the last 20, 25 years switching to single-use
that was what device. They asked for.
It's fine that you want multiple devices, but we can't do that. We certainly can't do that overnight.
No.
All our systems are set up, all our research is set up, all our sales and marketing, our sales force is trained in going out with...
It's a lot to ask a huge global company to change their line of production. We know that. So what we need to do is, of course, to come together and not just across the sector borders, like I said before, but really also across national borders. Yeah. And in Denmark, we could start by coming together across the regional borders, of course, saying we need to address this commonly, because the industry, of course, they can't meet 27 different demands of sustainability from each region in Denmark, Norway, Sweden, Iceland, whatever. So the more the merrier, I think. If we can actually come together and say, okay, we want this and that and that, and those are the three most important things. Can we do that together? And then we are a lot of people who are willing to buy it and
I think there's a huge need for industry alliances and joint, just like the Nordic Packaging Initiative and other...
I was just about to mention that's like a first step. And
could you briefly describe it for our
Yes, I can. It actually started with one of my very good colleagues in our procurement department, who she called in from all the Nordic countries, starting in Denmark, all the regions, saying if we could classify some very concrete demands according to packaging for medical devices, what would it be? Okay, needs to be less thick. What could you say? The
thinner,
less the thinner you can make it, less material, of course. And if you can use recycled material, do that. And do use monotypes of plastic and paper, stuff like that, so we can actually recycle it for the end.
Don't pollute the fractions.
And I can't remember it exactly at all, but you can look it up. But they have now been proven. It's taken years. It's taken 2 years, I think, if that's enough. It's taken 2 years from they started actually defining the criteria, the overall criteria, and then the approval, the process of approval in Denmark and in Sweden, Norway, Iceland. Can't remember. I think Finland might be about to join as well. I don't know. But then we are somehow at a high level enough that for the industry to actually start listening. And now it's on its way to the EU. Hopefully, it will be common for the whole EU to put up these common demands as a minimum. You could say, right?
There's a storm of sustainability regulation coming from
there
EU,
is.
and I think also a clear message from my side. I don't know if you agree, but to any of our listeners from the private companies out there, pharma or medtech, who are sub-suppliers to these hospitals, get in there, get engaged, because it's coming whether you like it or not. So having a proactive dialogue and making sure that it's feasible for the private company as well is a much better way to.
And the Nordic criteria for packaging is actually also a help for the companies to somehow live up to some of these demands in a very concrete way. So start the journey right now, because this is what we are going to demand, and it's also what you're going to you need to deliver in a very few years. So in some way, it's also a way of supporting the right steps for the companies. A
lot of what we work with is helping private companies navigate these spaces and how to interact with that, and where we do. It's I think it's going to be a lot more comprehensive that a lot of people know that if you're coming out as a salesperson, I'd say almost already now, but definitely in a year or so, and you don't have just a basic understanding around sustainability, there's going to be a lot of dialogues that you really can't interact with, and a lot of the tender criteria and stuff.
And you can say historically that the medical industry have been accepted from some legislative demands until now, like PVC, for instance, or the what's called HFC gases as well, where you could say, it's forbidden everywhere except the medical and medtech area. You can use it still. And everyone needs to mark their products of plastic with which type it is, except the whole medical industry. But I think those days are kind of over.
Yeah, I agree.
Yeah, because some of the new things that are coming, we are not accepted anymore. So, which is good, of course.
And also there's just a forcing function, like you mentioned, that you do your own greenhouse gas accounting at the hospitals. You have set goals where you have some ambitious reductions to do. More and more hospitals and healthcare systems are doing this. And given that is it 85 or 84% in the central region of Denmark? It's roughly there for most hospitals. It's a lot for all hospitals. Given that's where the emissions are, there really is no solving this without the suppliers.
No.
So therefore, of course, it's going to work its way into procurement and into tenders, even if there weren't any official regulation, which there is also coming, just by the fact that you have set some goals that you need to live up to.
Yeah, but really, I think it's I think we can all feel vulnerable somehow in this transformation, because we can put up demands, but I mean, what can we do in Denmark if we demand but we're so small. I mean, we can demand whatever we want, and we can have all the right words and motivations and values and pictures of a globe and a green heart put on top of it. But if a huge global company don't see the idea, if there's nothing in it for them, then they won't change the production line somewhere on the other side of the globe, because Denmark really are being ambitious now. Yeah. I mean, we really need somehow to find that common sense and that win-win situation where we all understand that both on a short term, but definitely also on a, I wouldn't say long, but longer term, this is good business, because the climate change and the effect on health and on our resources and on our supply chain in general as society, the stability of society, it will affect us all. Yeah. And it will affect our possibilities of living a healthy life with the resources that we are used to. And I mean, it is, those are, I don't know if you could call it big words, and it can be a bit fluffy, but it's true.
No, it's
coming,
true.
and it's not that far away, actually. So I think that's really the common ground we need to stand on, saying, okay, we need to find those solutions that's working for all of us.
And I think there's a lot of, I mean, I work every day with these global major players.
You do?
And
say hi.
Yeah, I will. and they're it's very interesting because they're packed with value-driven people as well. Yeah. Of course, ambitious people so also want to do career and whatnot. But in general, if you work in medtech or pharma, you also chose that to make a difference.
Yeah, of course.
And I think part of it is like we talked about before, that there's been a lot of exceptions. It's not really been a thing in the industry. And then we're in a very interesting situation right now where we, all the major pharma and medtech companies, the CEO and the board have been out now saying, this is a top 3 priority for us. We're setting climate goals. We're supporting SBTI, and we want to be net zero on scope 1 and 2 in 2030, whatever it is, these things. And then you have a lot of, I call them heroes, like passionate individuals who are making something green or sustainability related happen where it shouldn't really be able to happen, whether it's that it's production or commercial or clinical. But that's the leadership lab in between. There's a huge execution gap there where translating that corporate sustainability strategy into, okay, so this is what it means for our commercial area for this product line, or taking, like we have also talked about in the other episode, multiplying and scaling things that work, where we will find, okay, then they're reusing ethanol 8 times at this factory, and
it's a system change.
Case. Yeah, exactly. Moving from a hero to a systems approach, we also call it. That's really the gap. And I also see definitely it's coming. Like you said, we can't really make a difference just in Denmark, but it's moving so much forward now in Northern Europe that some are starting to take notice, and then NHS is obviously the star here. I don't know how they get the energy to working all this stuff in sustainability with all the other things that are going on.
No.
But the great thing about NHS is that they're too big to ignore. I mean, you cannot really be a global medtech company and say, we're not just going to sell to those guys. So what I'm seeing a little bit happening is that the Northern Europe is being viewed as a crystal ball, and they say, okay, so if it's there now, then it's going to be in Southern Europe in a couple of years or so, and stuff like that. But there's a long way to go.
There's a long way to go. And if I did say anything that could be perceived as that we can make a difference in Denmark, I definitely want to correct myself, because that's not what I meant. Yeah. I meant what you were saying, if we just close the door around Denmark and start sorting our garbage and using less and making huge progress, then it won't make a difference according to the 1.5 degrees or not.
Yes.
Because we are too small. Yeah. So even if all of Denmark stopped emitting anything, the water would still be rising on the globe, because we are such a small player on the field. But that does not mean that we can't set the direction of the game.
No, exactly.
And that's what we should be using, our position and our the welfare society we have to do. And we have a rather flat hierarchy in Denmark compared to other countries. So the possibility of making these collaborations across borders in all sorts of direction and through the value chains, they are here. We can actually do it. So that's how I think we could make the biggest difference, so that they really find some good stuff when they look in the crystal ball. And we should spread it out.
So what would your advice be to any private players listening out there who wants to get engaged with sustainability and be proactive with the healthcare systems and hospitals that they're working with?
The first thing that comes to my mind, which I don't know if I regret, but reach out. I mean, we want the dialogue in the healthcare system. And I think that's a very important place to start. We need transparency from both ways. They need to know which directions we see ourselves moving in. And we need the transparency according to the value chain if we want to be able to work with it. So it sounds quite basically, but I think we need to reach out. We need to talk to each other to find that common ground and establish the right concrete corporations, because we don't need to make another visionary paper across borders.
We have enough PowerPoints.
Don't do that. We need to make a project, concrete, where we set up some goals that we are willing to work for, to reach. Saying now we want to change the consumption within this area. And trying to design thinking as well. How will this area look in the future? Where are we in 20 or 25 years? Let's design that together instead of just rolling along and letting it design itself. Let's actually try to put up a direction.
And I love your focus on the action part. We are lucky to be involved in a few public-private partnerships around these things like this, where you look at a surgery theater or something like that and say, okay, let's try and map it out here. How can we, like you mentioned in the other episode, get all the different actors involved and say, okay, sterilization people, they're happy, or are we still for the health economics people, we can make this work. And because in my experience, there's always like 20 or more smaller problems that you have to fix, or value problems that you need to adjust to different people. But the good thing is when you then start taking action, you can most of the time untangle these things. It just
you can try anyway.
Exactly.
And if I should add another perspective, it would be how, if we really want a sustainable healthcare system, then there's also a need for us to focus a lot more on prevention than we do today.
Yes, definitely.
And not just focusing on it, but really making a good business out of it. Because not even for the public sector, there's a good business in prevention. And that's really, stupid. Because that would be by far the most sustainable, valuable thing to focus on as society. Please do keep people healthy. So right now we're talking a lot about, there's a good business in changing the things and the machines and the this and that we're using. How can we do that differently? And that would be great. But it would be even greater if we could make a very good business out of keeping people healthy. To make a company, we should have thousands of companies blossoming up, both private and public, saying, our one mission is to keep people healthy, not to innovate on whatever things we use when they once have gotten sick. You catch my point.
Now we're gonna have to talk for 2 more hours, because this is so passionate talking. But just a few. I completely agree, and it's it's ridiculous. In the Nordics, we spend around 10% of our GDP, 10% of the economy on healthcare. And out of those, I think it's 0.3% that are being spent on preventive measures. So there is this 5-5 aspiration on getting it to 5% sick care and 5% healthcare. But as I talked to the CEO of a Danish hospital, and he was like, but I think it's a great idea. I don't get a single euro for being preventive. So and I'm having such a hard time just keep everything functioning with all the challenges that are there. One thing that's very interesting is that outside of Denmark, we're also working with insurance companies. And they're super interesting, because if it's not organized around the public sector, they will often be the payers
There's some motivation
for healthcare.
yeah.
So there we are doing some very cool projects with preventive healthcare,
right?
And finding different ways to because there's reasonably good data on various things that if you do checkups or other things.
But there's plenty of evidence-based
exactly, because
prevention.
they have the. And then there's, of course, the risk of overdiagnosing. With a quick plug, we have some great episodes with Alexandra Jønsson, which it's always it's complex in healthcare.
Yeah.
But we need a preventive healthcare system.
Yeah, we do. And we need to make a business out of it.
Yeah.
Somehow.
And the tricky thing is the incentives. That's
it is.
There are many tricky things, but that's a key one.
Yeah. Right. And you also mentioned the health economics before, and in general, it's quite. It puzzles me sometimes that how easily we have accepted the fact as society, as healthcare system, that when we evaluate some sort of treatment, we need to consider the finances. Yeah. That's quite commonly accepted. We can't just do this and then start doing something. We need to somehow stop and check, okay, it's quite expensive. We will save this many people. And if we don't, we will do this. And blah, blah. We do those considerations. And it can seem quite cynical. But of course, we have to do that because if we spend all the money on this kind of treatment, it won't be there for something else. Yeah. And it will have another consequence on health. That's why we're doing it. Why is it so hard for us to accept that we need to put sustainability in here as well?
Exactly.
Because if we use and emit so much CO2 and use so many resources on this way of treatment, maybe, then it will have consequences on this and that, which is also affecting health. Yeah. But we're not there yet. Yeah. But that is one of my dreams, that someday it will be a parameter as well.
I have something for you afterwards then. It's it's not published yet, but we created a draft of a paper together with some researchers on including LCA data in health economics and value-based healthcare models for exactly that reason.
Wow, we should cheer if this was not just water, but thank you. That sounds great. Wonderful. We definitely need that.
Yeah. I mean, it's an early stage paper who definitely don't come with how to fix all that, but lays out the necessity of why that really needs to be the case.
Sounds like a step in the right direction anyway, so congratulations on that.
Thank you so much.
Wonderful.
And thank you for coming. We could talk for hours, and I'm sure we will do at other points in time. It was an absolute pleasure to have you here, Maria. Do you have any message you want to say to the listeners, or?
I feel like I've said so much.
You have.
I'm not sure. But message to you is just thank you for your work and thank you for reaching out because different sectors as well here in the room, actually. So thank you for making that connection. And thank you for having me here.
Our pleasure. It was an absolute joy and a lot of good stuff.
Thank you.
Thank you so much for listening. If you enjoyed the show, I would really appreciate if you started following it. Only 8% of the people who listen to the episode are following the Sustainable Healthcare podcast. And that means that you might miss out on interesting episodes. And the more followers we have, the easier it is for us to get cool guests into you to do this. And I really enjoy doing this, and I really enjoy speaking to you listeners out there as well. So fortunately, I get to talk to more and more people who are actually listening to the podcast, and I'm just so thankful for that, and so thankful for all the good work that's being done out there on sustainability in the healthcare sector. So keep up the good work, and hope you enjoyed the episode. Take care.